Hi, Gabriela. Can you listen to me?
Hi, Doc. Good afternoon. Yes, I can.
Perfect. Well, let's start. Today is earlier and I think it's better for you.
Yes, it is.
Perfect. So did you prepare the material I was asking for?
Yeah, I'm not really sure if it's okay if I did
Don't
it
worry.
well.
No, don't worry. That's okay. Let me let you to share the screen, okay?
Okay. No, lo tengo en el. I have this in my iPad.
Okay.
So,
So
maybe,
how can I receive your report?
maybe if I take a picture.
Perfect. Send this by WhatsApp.
Okay.
That would be okay. There's no problem.
Okay. Oh, no.
So,
I'm going to send this to my cell phone.
perfect. Don't worry if it's not okay or is there any mistake. That's the idea.
Okay, I don't have really an idea about what to write. Then I remember that the last year I had to present a case report in my microbiology class.
Yeah.
And I remember that I had the slides. I used to have the slides and say, okay, it's going to help me.
Yeah, it's gonna be helpful. Don't worry, that's okay.
I think that. Yeah. I send this to your WhatsApp.
Okay, perfect. Let's wait a minute. It's gonna be here. Let me check my WhatsApp. Yes, I got it.
Okay, I wasn't really sure about how to organize information. And that's why I write like a case report. Then I have like the last workshop.
Yeah.
Then I say, okay, maybe it's going to be helpful.
No, don't worry. Let me check. Give me a minute. I'm going to share a screen and we are going to read it together, okay?
Okay.
Okay, I'm here. Yeah. My cell phone got into it. Okay. Okay, you are going to watch my cell phone screen. Yeah, you are here.
Yeah. Again. And then.
Yes. It's uploading. Okay, now it's better. No, it's better for me, but not for you.
Yeah, but don't worry, I have this.
Yes, you have your screen. So let's start reading, okay?
Okay. A 15-year-old female patient presents nausea and dizziness. On examination, the temperature was 38.15 Celsius degrees. Respiratory system go with white phlegm. I'm not sure if it was like that, but it's urinary system for urine for gastrointestinal system. Nothing to add. For Central nervous system, nothing to add. For cardiovascular system, nothing to add. On blood pressure, we have 120 over 60, 60, ¿cómo? 66.
66.
Yeah,
Mhm.
and I'm not sure if it's, or how do you say, millimeters per mercury?
Millimeters of mercury could be, but don't worry about the unit at the moment.
Okay. With the respiratory rate, it's 21 over minute per minute, I think.
Mhm.
And heart rate is 92 per minute.
Okay. Okay, let's start with this. Do you remember the guidelines we got with the about the case report, I mean?
Yeah.
Yeah. Okay. Do you have them clear next to you, closer, I mean?
Yeah, I'm going to open this. Just let me a minute.
Okay,
I have here.
because I have a mess in my computer and I cannot find it. Yeah, no, don't worry. I'm going to find it now and give me a second. Yeah, I got it. So let's stop sharing the screen, okay?
Okay.
I'm gonna share another screen, yeah, in order to check this. Where are you? Yeah, where are you? I'm mixing my screens, yeah. Following the guidelines, following the example about the case report, the first data we got here. Well, the general data of the patient is present, and that's okay. 50-year-old female patient. You have to talk in past. Do you remember that?
Yes, always right in past tense.
Yeah, no, don't worry. That's okay at this moment.
Okay,
That's the way that we are going to learn and practice, and then would be easier to remind these details.
Okay, I really forgot that.
Vomiting. Okay, when you talk about symptoms like nausea and dizziness, like in your patient, you have to talk us about the evolution time, the chronological order of the events. When it started, how many days the patient is suffering that symptoms, and when she decided to get into medical assistance.
Okay.
So we must complete this, but don't worry, that's okay in the point we are starting now. Okay, you are in which year? I mean, third or fourth?
Third year.
Third going to the fourth.
No, I'm starting third year. Oh yeah,
Okay.
third going to the.
Okay, because I have classmates from third, fourth, and one from first. That it's not easy. I said, why in first year we are here? I'm sorry. How do you get enough
Yeah.
time? Yeah. Well, in that way, don't worry. In other year, in third year, it's a good way how we are starting. Just add some information, okay? Add the chronological order when the patient started with nausea and vomit and dizziness. Which one was the first, nausea or dizziness? How many days the patient has the symptoms? About the, well, when you get a physical exam, the clinical evaluation as a fact, you have again a chronological order to talk about. And maybe, did you have at the university the opportunity to check the details?
Not really. I have a chronological one about nausea and dizziness, and then like 1 week, past 1 week, and the patient has the dog with white flame and full smelling urine, and I think that's
Well,
the order.
now she's with fever. When a patient
Yeah.
has fever, you must explain, or you must say when the fever started. 2 days ago, 1 day ago, just today. That's the difference between the diagnosis. It's a very important view. Moreover, when you have fever, usually heart rate changes, respiratory rate changes. I mean, the vital signs are not according to the fever at this moment.
Yeah.
Is 58. She's young at this moment and it's without accordance. But it's don't worry about it at the moment. The way we have to write down is to remind these details. The general data are present, perfect. We must complete the chronological order. Not important any treatment, labs, because at this moment we are not talking about it. Of course, everything in past time. And about the physical exam, don't forget to get the complete details. For example, for which one is your diagnosis?
Streptococcus pyogenes.
Yeah, but what kind of infection? Lung infection, urinary infection?
No, lung infection, and at the same
Combined?
time, yeah, have urinary infection.
Both infections at the moment. So when
Yes.
you get the physical exam, the clinical evaluation, you have lots of details in the urinary system, not just the smell. You have to make the lumbar percussion, for example, and you have to describe it. How painful is it? That's why in third year, you are not ready for doing this exercise completely, but it's a good way how you started doing this. So don't worry.
Okay.
At the end of the workshop, I'm gonna send you some details to the clinical exam and some lab tests for completing this, and it's gonna be the homework. Okay?
Okay, it's okay.
So don't worry, that's okay the way you're starting now. When you talk about the respiratory system, we were talking about the patterns about breathing. Do you remember the breathing patterns?
Yeah.
Chain stocks, Bayot, and many things. And the pulmonary sounds, do you remember them?
Yes.
Wheezes, cracks, you have to describe all of them. But don't worry, I'm gonna send you details as a list and you make the paragraph, okay?
Okay.
If I send you an X-ray, a chest X-ray, try to describe it. You are in third year. Don't worry, look for internet. There are lots of websites showing you how to make a good description about it. Just a general idea about what you are looking for. Don't worry on the taste, don't look for too much information. Just tell me what you see, and that's enough for me. Okay?
Okay.
And that's all. That's good. You use the abbreviations, yeah.
Yes.
Try to memorize, to practice with them, because that's the way we start. I'm sure
Yes,
that
I
all of
am
your
going to.
classmates are going to bring the same kind of job.
Yeah, I say I'm going to use the abbreviation because it's a way to not forget that.
Yes.
I'm going to remember. I said, okay, I need to write.
Yeah. No, so don't worry. That's okay. So at the end, as I'm telling you now, I'm going to send you the rest of the information, and then you complete and correct. Okay?
Okay.
This is the idea of the this first workshop, this first week. And of course, on weekend, we are going to have more assignments and quizzes. We have no choice about it.
Oh, no.
Yes, I'm sorry. We need to do it.
Yeah, it's okay. I think that it's wonderful.
Thank you so much. I took your attendance.
Okay. Bye,
So
teacher. See you Monday.
see you Monday. Bye.
Bye.
I received your WhatsApp message. I'm going to
Okay.
talk to the academical superior about this situation, okay? And
Okay.
tomorrow I'm gonna send you the answer.
Okay. Thank you. I'll be waiting for the answer.
Perfect.
See you Monday. See you Monday.
See you Monday. Bye. Hi, Fernanda.
Hi, Doc.
Hi, I'm sorry. I took 1 minute from yours.
It's okay.
Okay, how are you? How was your day? Everything okay?
Yes, Doc. Thank you.
Perfect. Did you prepare all the things I was asking for? Did you have enough time to do it?
Yes, Doc. I just changed something, but
Perfect.
rest is similar.
No, perfect. That's perfect because we have to start talking in your area, in the
Okay.
way you need to work on this, okay?
Okay.
Do you have it by WhatsApp or in your computer maybe?
And no, I write the
Okay. You did handwriting.
yes.
Okay, please, can you send me a picture? And then we are going to share the screen for reading together.
Okay.
Okay, perfect. In that way, yeah, I'm opening the WhatsApp, yeah. I have a mess in my computer now. Perfect, I just received yours. Yes. Okay. Please start reading the case report.
Okay. On examination, temperature was 38.3 Celsius degree. Smooth, firm, 3.4 centimeters mass in right supraclavicular fossa, notes 2 centimeters in diameter pulpoidal in both axilla and inguinal areas. Oropharynx, nothing important. Pulse 120 per minute regular. Blood pressure 160/90. Cardiovascular system, nothing important. Respiratory system, nothing important. Abdominal mass pulpable 3 centimeters below the costal margin. Central nervous system, nothing important.
Okay. Do you remember the case report?
Yes.
Do you have that information? How your pet came, why the owner, the mama, yeah, bring the kid to you, yeah?
Why also?
Well, that's the way of starting this exercise. For example, let me show you Gabriela's.
Okay.
I don't know where I got it. It's Gabriela's, it's opening. Give a minute, please, it's downloading. Okay. Well, of course, she is still learning like everybody in the group, and it has some mistakes. But that was the way I was asking for the homework. Can you watch my screen? It's in pink.
Okay.
Okay, this is the case report, these 2 lines, just the topic, the general data, the sex, and the symptoms, the situation that the patient is complaining of, right? In your case, you explain why the owner is talking about the symptoms of the cat, dog, pet, I don't know. And then we need this first paragraph in order to organize the symptoms. And then we get the physical exam. Well, Gabriela at this moment has to rewrite everything, but that's no problem. That's the way we start writing down and catching the idea how to do it. That's the best way for working. But I need from you this first paragraph.
Okay.
Can you try to talk about it now? Just talking. Imagine the situation and then we can write it down, correcting all the situations. Yeah. Of course,
okay.
we must follow the guidelines we have. Let me open the guidelines. Okay, now you can watch my screen, right?
Right.
Okay, following this information this way, always in past, general data of the patient, the chronological order about symptoms, not treatment because we are not going to take this. Organize the information and give me a case report. Tell me how your patient arrived to you, why he's taking the appointment with you.
Was 12 years old, a dog, 12 years old.
Yeah.
And
start writing down and send me the picture. Don't worry, that's okay. Don't worry, understand. Start writing down, and in the order you're writing down, you are going to explain me, and then we are going to correct it. Don't worry, don't be ashamed about it. There's no trouble.
Okay. It's a 12 years old dog, came with difficult to walk.
Yeah.
And licking the abdominal area.
Oh.
So then I after this paragraph,
then you write down the first paragraph and then you add the physical exam that you read now.
Okay.
Yeah, don't worry. The physical exam, we are going to correctly little details about the organization, but in general, it's okay. The case report and physical exam, that's better to start working together with that. And please, at the end, add the diagnosis you got.
Okay.
Right.
And it's female even for adult.
Yeah, that's the same.
Okay. I finished.
Perfect. Let's read this.
Okay. A female dog of 12 years old came with difficulty walk and licking the abdominal area. On examination, the temperature was 38.3 degrees. Respiratory system, nothing important. Or operating, nothing important. Cardiovascular system, nothing important. Pulse, 120. Regular. Blood pressure, 160/90. Central nervous system, nothing important. Smooth, firm, 3/4 centimeters mass in right supraclavicular fossa. Knots 1-2 centimeters in diameter for pivot in both axilla and inguinal area. Abdominal pivot 3 centimeters below left costal march.
Okay. Is that fever in the dog? 38? No, no fever.
No.
Oh, perfect. That's new for me. Yeah. I never realized, and I never asked myself about the temperature in a pet. When is fever in a dog?
It's 39.
Wow. Well, for us, it's dangerous at the moment.
Yes, even in cats.
Oh, in cats, they are so small. Wow. Well, in that order, which one is your diagnosis?
It's cancer with metastasis.
Oh, pobrecito. Okay, from the paragraph you read, you write down now, send me a picture.
Okay.
Okay, all of the information in just one picture. I'm gonna check the grammar way of writing down, and then I'm going to send you the rest of the job for weekend. Okay, that's cool. Okay, perfect. So let me send you the pool, Fernanda. And that's perfect. Can you watch the screen?
Yes, I can.
Perfect. Okay, thank you so much. Okay, let me check. Let me finish to complete the information, and I'm gonna send you at the end of the workshop, okay?
Okay, Doc.
Okay, bye, Fernanda. See you
Bye,
Monday.
Doc. See you Monday.
Bye, Angelica. Bye.
Hi, Doc. Good night.
Hi, how are you? How was your day?
Good, thanks. Very exhausting.
Yes, I think it's very Well, it's a cold day, even though, and well, we have to go ahead.
Yes, that it is.
Okay, did you prepare the clinical case I was asking for?
Yes,
Perfect.
a little case.
No, that's okay.
Okay, I'll share my screen.
Yes. Give me a minute. I'm gonna.
Okay.
Now, is that okay for you to share? Can you do it?
Yes.
Okay, perfect. Do it now. And please, you might send the picture to me, okay?
Okay.
your
My
WhatsApp.
screen is watching my screen.
Yes. Está
Okay.
compartiendo la pantalla. Yeah.
Okay. Well, you can see this
Yes.
cursor.
Okay. Okay, here we have one detail. Where is your case report? The resume of the symptoms of the complaints. Don't worry, add this information now.
Okay. Well, on exam, the patient have the temperature is 38.1 Celsius degrees. The pressure is 95 per minute regular. The pulse 95 per minute regular. The blood pressure is 110/70. Cardiovascular system, nothing to add. The central nervous systems, nothing to add, and respiratory system, nothing to add. The gastrointestinal system had blue meaning positive, diarrhea, and nauseous.
Okay, perfect. And the report about complaints, the symptoms, how many days the patient is suffering from that situation. We really need that detail in order to understand all of this information.
Yes, I forget.
Yeah, complete it now. Write it down now.
Okay. Well,
yes, don't worry.
They complain.
Yes, at the beginning, please. Let's organize this correctly because it's important to do it in that way, okay?
Okay.
Do you remember the guidelines I sent to the whole group talking about how to write down the case report, that first paragraph?
Yes, I think that I got it. So
okay. Okay, let's do this. Stop sharing the screen and I'm gonna share my screen to you.
Okay.
And following the guideline, write down that resume, okay?
Okay.
It's gonna be, I think, useful to check that information now. Okay, can you watch my screen?
Yes.
Okay, let me move this. We have here the guidelines, of course, using medical terminology. It's a brief paragraph. Don't forget at the beginning, like this one, the general data of the patient, adding the occupation if you consider it's necessary, okay?
Okay.
Don't forget the chronological order about symptoms, organizing them in the order of appearance, maybe at the beginning of each symptom, how many days the patient is suffering from each symptom, and well, avoid any treatment. We don't need it now, and everything in past time, okay?
Okay.
Write down, invent information. There's no trouble for me. I just want to check how you are organizing ideas.
Okay, so I'm going to write now.
Yes, write down now.
Okay.
Take a deep breath. Don't worry, it's not a test. In the test, you can be nervous, but here,
yes.
no.
Okay. Well. 35. 3-4 years. Oh, the occupation is important.
If you consider it's important, write it down. If it's not, don't worry. It's just an extra information. I mean, we're taking importance on the risk, laboral risk.
Okay.
Okay.
Student. That one question.
Yes, let me know.
In what part of the case report I have to put the number of the position in the case of that area?
Which one is, well, you are going in order to the chronological beginning of each symptom, right?
Okay.
When patient tells you, I've got diarrhea, I don't know, 2 days ago, when you start talking about the symptoms, you get the characteristics of the diarrhea. If it's liquid, if it's tarry, if it's, I don't know, with, what was the word? With offensive smell, if it has flames. In that way, depending on the position, when you arrive into a symptom, try to give the details of that symptom of each one.
Okay.
Not mixing information.
Okay. So in the part of the examination, just I have to put diarrhea.
On exam, you don't talk about diarrhea. At least you watch it at the moment you are evaluating the patient.
Oh, okay.
For example, a patient can refer, you can complain about diarrhea in this case. But if during the physical exam there is no the diarrhea, you don't have to talk about it on the physical exam. You can talk about the abdominal pain, abdominal tiredness, about the, I don't know, a mass that is palpable, something like that,
Okay.
something that you can prove by your hands.
Okay.
Okay.
Okay. I'm going to continue. Presenting pains in the right direction. Years ago.
Okay, do you have now all the information?
Um,
Don't worry if it's not complete.
okay.
Okay.
I share my screen.
Yes, share yours.
Okay. Okay. Okay.
Perfect.
This is what I got. A female, 25 years old, student complains intense pains in the right iliac region 8 hours ago. And now to put the area.
Yes.
Notion when it started. This is a case of appendicitis.
Perfect. It's clear now. Okay. Well, appendicitis usually doesn't get into 38. At least it's complicated.
Oh, okay.
It usually stops at 37, 37.5.
Okay.
But don't worry, just a clinical detail. It's, of course, it's different from each patient. Okay, give me the symptoms, the complaints. With intense abdominal pain in the right iliac region about, well, the patient is talking like this. Well, it's your report. That's okay, 8 hours ago. Do you remember the Murphy sequence?
No.
Don't worry about it. Write down as much symptoms as you can get, organizing the chronological appearance of each one, the chronological beginning, I mean. And if there is any detail, for example, diarrhea with flames, with blood, add it, there is no trouble. But if you told me about that kind of diarrhea, it's not appendicitis.
Okay. So I complete that and we'll send you to your WhatsApp.
Yes, send me a picture completing the information, complete this. Remember the guidelines, everything in past, all of the details we have to check, okay?
Okay, perfect.
Okay, let me send you the pool in order to take attendance.
Okay.
Because, well, now you got the idea about it, don't worry.
Yes.
That's the way we start writing down. Don't worry, it's for practicing and that's okay.
Okay, yes, thank you. Now it's clear.
Okay, complete it now as soon as possible and send it to me earlier. At the end, I'm gonna send you some lab tests and more details in order to make homework during this weekend.
Okay, perfect.
Okay, nice to see you, dear. See you Monday.
Okay, see you, Doc.
Bye-bye. Hi, Natalie.
Hi, Doc. Good night.
How are you?
Fine, and you?
Fine, everything's okay. How was your weekend? Your weekend, your day?
It was good, actually. And yours?
Well, running and rushing with everything with my kids, but that's okay. It's usual now. Okay, my dear, did you get all the information I was asking for?
Yes, I didn't do it in a Word document, but I'm going to send to you as a WhatsApp message.
Perfect. It's a picture, I mean?
No, it's a message. I wrote it in my cell phone.
No, perfect. Do it and send me the message now, and then we are going to share the screen.
Okay. Did you receive it?
Yes, a 3-year-old woman, right?
30. Yes.
Yes. Give me a minute. I'm gonna take a copy to Word, and then we are going to share it, okay?
Okay.
Okay, you made it with more details than your classmates, and that's better. That's good.
I was stressed. I didn't know what else put because I didn't learn about appendicitis yet. I think I'm going to learn that this year. So I was searching on the internet.
But you made a great job, right? Reading us so fast. Okay, let's start reading together. That's perfect. You are giving me details that nobody talked about them, and I like it. Go on.
Okay.
Okay, can you watch my screen, right?
Yes.
Okay, let's read this.
A 30-year-old woman who had been experiencing right lower abdominal pain for the past 6 hours. She had nausea and vomiting. She had been constipated for 4 days.
Yeah.
Appendicitis.
Okay.
On examination, temperature of 37.9 Celsius degrees.
Okay, a detail. When you give the temperature, you don't say point, you say dot. 37.9.
Okay, 37.9 Celsius degrees. Blood pressure, 111. And how do you say that? 75?
Over.
Over.
Yeah.
111 over 75. Positive rose bean signs, abdominal bloating, pain in percussion, and abdominal tenderness.
Perfect. You have the Robson, that it's one of the most important signs in appendicitis. But let's organize a little bit, okay?
Okay.
Do you have the occupation of the patient?
It can be a doctor.
Yes. We always go late to take medical assistance.
Okay.
Doctor who had been experiencing. Okay. We can give this expression. That's perfect because it's in past. I like it. Yes, it could be. Lower abdominal pain, right lower abdominal pain for the past 6 hours. Perfect. She had nausea and vomiting. How many times the patient is with that complaints? From the beginning, I don't know, for 2 hours, just at the moment.
Okay, so I have to put
the time that
okay.
are lasting the symptoms could be important, because in appendicitis, it's not just the pain, the cardinal symptom is all the Murphy's chronological situation, I mean.
Okay, so it could be she had nausea and vomiting for the past 2 hours.
Could be 2 hours, or sometimes in some patient, nausea and vomiting start earlier than the right lower pain.
So she had nausea and vomiting for the last 8 hours, maybe?
Could be.
Okay.
Okay, she has been constipated for 4 days. Okay. In general, in any history, clinical history, the diagnosis goes at the end, not when you finish the case report. So don't worry, that's okay. On exam, could be. Do you have the pulse of the patient?
That was my question. How is the pulse when a patient has appendicitis?
Normal.
It's normal?
Normal.
Okay. So
when you have a patient with shock data, I mean fever, low BP, high pulse, or high heart rate, it's entering into the shock. Usually in appendicitis, you get in shock when you have this clinical situation more than 1 day. In some patients, more than 12 hours, but with 8 hours, it's normal.
so it's okay, 75?
Perfect.
Okay, 75 slash minimum.
Yeah, but could be a slash or the writing down way.
Okay.
And you said beats per minute.
Okay.
Okay, now you do it in a good way. You can go just to the findings. Yeah, I did because it's in that it's in the gastrointestinal tract and there is no trouble. But try to specify this point.
Okay.
The GI, tell me where the symptoms you are finding down, and that's all. No worry. You have a abdominal bloating. You have an order of the techniques about doing it. Inspection, percussion, inspection, auscultation, percussion, and palpation, right? In the abdomen. Following that order, it could be nice. For example, in inspection, you don't see changes in skin color, you don't see any blunts, so there's no trouble. About, for example, auscultation, what did you found? Don't worry, when you got appendicitis, you go low. Bowel movement or diminished bowel movement, for example. And while you are auscultating, the patient feels pain when you get in position the stethoscope.
Okay.
And that's a sign that is showing you that sometimes it's so tender.
Their appendix. I read too that patients with appendicitis, they can't pass gas. So
Yes.
we can hear that with the stethoscope too, right? How can
Yes.
I say that?
Out of or without. I don't know what I. You can say without bowel movement. You are supporting what you hear.
Okay.
Peristaltism, it's better to express like bowel movement at this moment. But that's okay. But then you said in which part of the abdomen? Right low quadrant, and that's perfect.
Okay.
Now you got the idea, you are expressing where it is, where the situation is in the trouble.
Yes, and there is any abbreviation for abdominal bloating, pain in percussion, and abdominal tenderness? No.
No.
Okay.
You can say just ABD. I'm sorry. I'm making lots of mistakes with this. ABD bloating, for example.
Or ABD tenderness.
And just go into a line.
Okay.
Not repeating. You heard here ABD, don't repeat again ABD.
Okay.
That's not important. Just organize the ideas in the way you are preparing this.
Okay.
Okay. So, for example, you are giving me these symptoms while palpation, enough. Pain during percussion, not in percussion.
Okay.
Pain during percussion, where you have to tell me specifically where it is.
Right lower quadrant?
Yep. Right low quadrant, and that's enough. Of course, percussion goes earlier than palpation, right?
Yes.
Without bloating and I don't know what I did. Okay. I don't know what's happening with me with this at this moment. Okay. The rubs in palpation, abdominal blowing and tenderness. Which place you might place this, I mean?
Abdominal bloating and tenderness. It is in the right quadrant too?
No, that's okay. But you can You say these ones with both information, we know that all of the symptoms are here, or maybe you can say in this way, you can give this idea. ABD in RLQ with, and then you explain all the symptoms, organizing it. As much as you can resume this is better.
Okay.
It's just organizing the idea. With low bowel movement, lowering, tenderness, boxing, positive, and that's all.
Okay, yes, it is in one line only.
You can see in one line, we have all of this information, right?
Yes.
But
So,
if you need,
shorter better?
yes, in English is better. In Spanish, this is a good way of describing the situation. As much as you can resume this, better for you. When you find dropsing, well, it's just one sign. You need at least 2 signs. You have more. You have the lance technique, the maniobra de lance.
Okay.
You have the Murphy point. You have the Blomberg. Blomberg is general for many situations, but Blomberg gives you an idea that something is inflamed into the abdomen. So try to support with more details, but at this point, you made a great job. Okay?
Okay, Doc, thank you.
So
Yes.
that's a good way. You are studying at the university, you are in an early year, and you made a great job. About the picture you wrote down, please send me one to my WhatsApp, okay?
Okay.
And following that information, I'm going to correct all of this, okay?
Okay, just a picture, right, of the Word document?
No, just a picture. Oh, no, you sent me a message, right?
Yes.
No, that's perfect. With that message, I'm organized. Please rewrite it with all the corrections we are checking now, and then send me the picture of the corrections. When I finish the workshop, I'm gonna send you some lab tests and another test that we were talking yesterday. And from that information, we are going to work on this weekend. It's gonna be homework, the rest of the exercise.
Okay, thank you, Doc. So I'm going to send it to you.
Okay, thank you so much. That was a good job. I'm proud of you. Thank you so much.
Thank you, Doc.
Let me send you the pool in order to take attendance.
Okay.
So you can see it's not as the same as writing down in Spanish, right?
No, it's different.
It's different. It gets harder at the beginning, but when you get in practice, it's easier to write down in English or taking the topics because you get an organized idea and you are not rounding and rounding like in Spanish, and you are not wasting time.
Yes.
But here in La Paz, in Bolivia in general, we have to round some ideas in order to avoid loud troubles. So that's important to continue in that way.
Yes, it's different.
Yeah, but you made a good job. That's perfect.
Thank you, Doc.
So correct it. Take your time. Don't worry. We have until midnight to do it. And tomorrow during the day, I think I'm gonna send the files with the homework because in order each student bring a different case, I have to prepare different labs.
Okay. So
That's
if we have any questions, we can write to you.
Yes, do it because the corrections you send me and the homework you send me back,
Yes.
it's gonna be homework, and of course it's gonna be to evaluation. This first exercise, when we are correct in checking how you made the job, it's not for evaluation yet.
Okay.
That's a good way of starting.
Yes.
Okay, so take a deep breath. Yeah, let's go ahead. And if there's any questions, send me a message with all the confidence, don't worry.
Okay, Doc, thank you very much. Have a good night.
Thank you so much. You too. Have a good night. Have a nice weekend.
Thank you,
And
Doc.
see you Monday.
Bye, Doc.
Bye. Hi, Dr. Pamela.
Hi, Miss. Good
Hi,
night.
how are you? I was reading your case, and that's amazing. It's not a common one. I like it.
Yes.
Yes.
Es un caso que hubo el año pasado acá, que prácticamente, bueno, yo lo publiqué en la sociedad. Y
Yeah.
sí, es algo raro. No pasa siempre eso.
Yeah, Adelphus uterus, right?
Yes, yes.
Yes, when I
Como
read it, I said,
información.
what? Yeah, great, amazing.
No, es que el otro día que veíamos lo del caso, yo no lo entendía porque era más cardio. En cambio, ya,
It's
ya
just,
viendo el dolor y el sangrado, ya
yes, it's for you.
es
It's
más.
your case. No, but that's amazing. I never check Adelphus uterus at this moment, but I think I'm gonna do it. Anyone. I was reading this. Can you watch my screen, Doc?
Sí, Miss.
Okay, perfect. When we were talking at the beginning about, hi, can you listen to me?
Yes. Female, ¿o dónde?
No. Okay, let me explain you this. When you use this way of writing down, it's perfect for publishing like a study and in a newspaper. It's like an article. I mean, for research. That's a different way of writing down from the clinical history, right?
Okay.
So you have here lots of details that at this moment are not important. That's why we are going to correct it, okay? Because we are practicing how to write down the clinical history. We are going to get into the articles, case reports for research almost at the end of the module 2. So don't worry, that's okay at this moment. So let's start checking the information that has to be here.
Okay.
Okay, female patient, 20 years old. Perfect. So female patient could be, or maybe 22 years old, female. The capital letters, perfect. Do you have the occupation of the patient?
Yes. Iniciales de la paciente.
No, the occupation, where she works.
O sea, del nombre de la paciente. Digamos, Viviana,
No,
Mamani.
No, ¿en qué trabaja? ¿En qué
La paciente.
Yeah.
La paciente.
Sí.
Labores de casa.
Okay, housewife. When we write down the clinical history, we ask for it in order to check the laboral risk, right? Personal or family history of interest of diseases, it's not important at this point. We have a specific chart to talk about it, but it's in another place of the clinical history.
Okay.
Okay, it could be okay, here. I know, me he equivocado al poner. Reporting. It could be, we have to remember, as less you write down is better.
Okay.
You have to make a brief paragraph, as brief as you can, okay?
Breakfast.
With, could be with, I'm underlining just, and then we are going to work on this. 4 hours of sudden onset presenting intentional abdominal pain. Okay, could be this one, that's okay. Okay, let's rewrite this. 22 years. Ay, ¿qué estoy diciendo? Years old. Housewife. Patient. To the Pinto Health Center complaining of intense and generalized abdominal pain. Then she was referred to Hospital General San Juan de Dios, Corea. Korea. Korea. Then she was admitted into the department. Es que me pasó, estoy escribiendo bien chistoso. Department. Okay, you can see this could be a resume, a very brief resume about all the situation for the clinical history. Okay.
It's okay.
Because we have to try to take as less as a huge resume of this.
Okay.
And now we have to say this. How many times she was with this abdominal pain? That was lasting around 4 hours. 4 hours. Not 4 hours. Okay, perfect. 4 hours. Did she have any symptom? More symptoms, maybe?
No. Pain y sangrado, ¿no?
Okay. Hours, vaginal bleeding, right?
Yes.
Vaginal bleeding. How many times she was with the vaginal bleeding?
O sea, era escaso, pero más era como que el dolor, porque la hemorragia era interna, o sea, era una ruptura uterina, pero, o sea, era la hemorragia interna que había.
Okay.
Por eso solamente era como que el dolor.
Small quantity, listo. And then she was referred to Hospital San Juan de Dios.
Y los signos vitales, ¿no? Que nos dan como para un shock hipovolémico por la presión y la taquicardia.
Department. Okay, when you have the case report, you just talk about complaints and how she was moving into the Vinto Health Center to the Hospital General. That's all. The symptoms you are going to talk about here on exam, and then you can talk about symptoms with all of the details. That's the way we work on a general, on a clinical history. The paragraph you prepared, this big one, is perfect for research, for an article, in the way you were presenting this. That's okay. But for the clinical history in English, it's different. That's why writing down
Okay.
the studies research is very, very different from the clinical history in English. In Spanish is easier.
Okay.
It's very easy in comparing those information. You can say here vital signs, like American ones, and then you give us all of the vital signs. Pulse, BP, of course, instead of pulse, it's better heart rate because you are supporting hypovolemic shock, right?
Yes.
BP, respiratory rate, temperature, I mean, of course, the saturation, we have to talk about it at this moment because without, we don't know if she's getting into shock or not. Then you get the, instead you go to the, in this case, you can add here the gynecological antecedents could be the history. Yes, and that's okay. And the partos, abortos, cesáreas. Well, in my school we had the partos, abortos, and cesáreas in that order. In Spanish are all make it mixed. It's different from my school, but that's okay. That's the way we can start in this specific case. Then you are describing all the findings you have. On admission, we found pressure and permanent principle on the pain. Okay, you have to talk now about the findings. Talking about findings, you just go system by system or maybe by a region. In this case, you are going to talk about the abdomen, and then all the findings organized, organizing the chronological order. I mean, inspection, auscultation, percussion, and palpation.
Okay.
So we know organizing this, and that's correct. And now, of course, finishing the abdomen, we have to talk about the genital system, well, the bleeding, the vaginal bleeding, and all the characteristics you are describing here, that is perfect. And when you support shock, we need the cardiovascular system. We need the central nervous system, and I think that's all the most important parts. If you have this information, perfect. But if you don't have it, don't worry, that's okay. There's no trouble for me.
Okay.
This part, ultrasound, the treatment you applied, the exploratory laparotomy, at this moment, we don't have to talk about it now. That's no problem. That's a good paragraph for research. But for the topic we are following now, don't worry. Okay?
Thanks, Miss.
Okay.
Le mandé lo de las fotos, que igual que es de la paciente.
Thank you so much. Perfect. When I was reading your paragraph, I said, wow, it's amazing. I love you, Doc. So, following the example while writing down at this moment, correct the information you have. Now you catch the general idea. Write down all of this information. That's okay if it's by a message or maybe by handwriting, and send me a picture to my WhatsApp. Following your directions, I'm going to send you back homework at the end of the workshop or maybe tomorrow morning, okay?
Okay, Miss. Thanks.
Okay, no, thanks to you. Let me send you the pool in order to take attendance, okay?
Yes. All right.
Perfect. Thanks for doing homework. And thanks for making this effort. So you can see it's different. Okay, Doc. See you Monday.
See you Monday.
Hi, Lucia.
Hi, how are you? Good evening.
Fine. How are you? I took 1 minute from yours.
Oh, it's no problem.
Okay, don't worry. Well, maybe you could watch the example I was talking to your classmate, to Dr. Pamela.
Yeah,
She's
impressive. Very impressive. It was
Yeah.
very extensive and very long.
actually she's a gynecological specialist and obstetrics.
Oh, nice.
Well, she's living in Oruro and she has amazing cases. I mean,
I can imagine.
yeah, the case she sent is very, very impressive. I said, what? Yeah, let's read again. Yeah. Well, patience.
Yes.
Okay, in order you don't have the full information to do this, I took a dialogue.
Oh, okay.
Working tonight. Okay, I told you that we were going to get that.
Okay.
This is a dialogue I have from my principal book, I mean.
Uh-huh.
And this dialogue is the one I took into the test. So it's perfect for making a case report.
Okay.
So let's read it together. And you are going to write down the case report. I'm going to send it to your WhatsApp at the end of the workshop, okay?
Okay.
Let me share the screen, give me a minute. Okay, can you watch my screen?
Yes, I can.
Okay, let's start. Let me give you the idea of Mr. Hamilton, yeah.
Okay. So should I start reading or okay?
No, yeah, give me a minute.
Okay.
Mr. Hamilton is
50-year-old?
no, I forgot how to say jubilado.
Retired?
Yes, thank you. Yes. Retired 72 old list. Okay, go ahead.
Okay. Then
You
we can say
okay, you can read it by your own if you want. There's no trouble. And do you have a piece of paper with you, a notebook, something like that?
yes, I do. I do.
Okay, taking this information now, write down the case report.
Okay.
If there's any question, that's okay.
Okay.
These findings are for me, don't worry, okay? Just
Okay.
the case report following the dialogue. Me está pasando. Okay, did you finish this?
I'm quite over it yet.
Okay,
I just
perfect.
have to find how to say like last part, how to add the last part. I can just say the patient and said that he has present with shortness of breath.
Yeah, what more?
Okay, I wrote a paragraph already. Should I read it to you or should I send it to you?
Let me give you the chance to share your screen.
Okay.
Okay, can you do it now?
Yes.
Perfect. Share your. Did you do it by handwriting, maybe, or in your computer?
I did it on my tablet. I don't know if you can see it.
No, perfect.
Okay. So, Mr. Hamilton retired, 72 years old, who has been a frequent or heavy smoker. I wasn't sure which one would fit better, so I put both, like on the top and maybe to the side later. And who has been a frequent or heavy smoker until a year ago when he gave it up. The patient presents a yellow-colored productive cough and indicates he has had it for years.
Okay.
And I just had to put the shortness of breath, and now I'll be finished. But that's how I did so far.
Okay, stop sharing, please. We're going to remind the way about writing down the case report. Let me share my screen again.
Okay.
Don't worry, that's okay, but you're thinking on Spanish.
Am I?
Yep.
Oh.
Don't worry, it usually happens, don't worry. Oops, I think I closed the file. No, it's here. When you talk with the patient, don't remember the way you start. You don't give the name again. And if you need to give the name, you use capital letters.
Oh, yeah, I
Yes.
forgot that.
So,
Say,
70-year-old retired patient could be, who has been, well, who's complained or who, how can I say that? Who came to the appointment, I don't know, or an expression in past, complaining of, or who complained of shortness of breath, productive cough, yellow cough, and that's all the symptoms he's talking about.
With, yeah,
and that's all.
Okay.
And that's all. So if we correct it now, okay.
We will say 72-year-old patient.
Year-old man, retired.
Who came to the appointment complaining of
who complained of could be, or who came complaining of, you have
Yellow.
to make that game of words, be creative, but try to be short and give that idea.
Okay.
Complaining of productive. I don't know. I'm writing down. Okay, yeah.
Happens.
Today
Okay.
I have my hands too cold. That's why.
Oh,
Doesn't matter. Of 4 years. Well, for a year. No.
4 years.
Yeah, for years. Okay. With you can see with color yellow with phlegm, something like that. Just go make a list of the symptoms, organize it chronologically. Phlegm and shortness of breath, on exercise, on exercise. So you remember that abbreviation? That was a big one, because he says that he gets shortness of breath while
When he came.
while going upstairs, and that's important because it's on exercise.
And it could also be an exertion, right? If I'm not incorrect. Okay.
So that's okay. In that way, when you make as less as you can, is better in organizing the way it is they are talking about, okay?
Okay.
So don't worry about it. It's just an example. I'm going to raise this. Well, we're almost on time.
Oh, yeah.
I'm gonna send you these findings.
Okay.
And write down all the physical exam. Do you remember the chart we were checking last class?
You mean yesterday or Monday?
No, on Tuesday last.
And
last workshop.
Oh yeah, I do.
Okay,
I still have it.
Yeah, you have the picture following that example, that order. I'm going to send you the picture of this, okay?
Okay.
By your WhatsApp, and write down again the case report and organize the physical exam. Okay?
Okay.
Describe all the findings, and if you can catch a diagnosis, add it at the end. Okay, just for having an idea.
Okay.
Okay.
So I should rewrite what you are going to send me as the way we did on Tuesday.
Yes.
Okay.
Write down the case report the way we are correcting it now. You don't have to give the history that he was a smoker, he left it. That's non-important in English.
Okay.
It's a good information because we as doctors need to get that he was a heavy smoker. But when you write down your clinical history, it's not as important, that specific detail, I mean. Thank you.
I'll think about it. Thank you so much.
No, don't worry, man. So give me a minute to send you the picture now. Write it now and send me a picture to my WhatsApp, okay?
Okay, I'll do it right now.
And according to the paragraph you prepared, all the information you prepare, I'm gonna send you X-rays and lab tests.
Oh, okay.
With that information, you are going to write down or to prepare the homework of this weekend.
Okay.
When we talk about the prominent abdomen, it's a big abdomen, of course. There you have more findings that are according to this clinical case. Try to look for them.
Okay.
If there is no possible to get the diagnosis, don't worry. Don't worry, we are going to check it, okay?
Okay.
Uy, Dr. Pamela sent me the pictures of the case she sent to me.
Oh.
Wow. Do you want to watch them?
Yeah, sure.
It was the uterus, the Delphus uterus.
Oh,
and well, with an abdominal pregnancy.
wow.
Okay, it's opening. Vaya para allá, ahorita.
Oh,
You can see the Didelphus uterus.
wow.
What? She's so brave.
Yeah, that's hardcore.
Yes, look at the placenta out of the uterus.
Wow.
That's the part that, wow, it's amazing.
Oh, the baby.
The fetus out of the uterus.
Oh, wow.
Wow.
Looks so tiny.
Yes. She is so brave.
Yeah, wow, that's really hardcore. I have no other word for it.
Yes. Well, so brave. She told me that she sent me the pictures, but I didn't believe in her now. She did it, yeah. She's trustable.
Yeah.
Okay, so start working on this, and in that
Okay.
order we can start working and start writing down. According to the paragraph you sent me back now, if there is something to correct again, I'm going to write down a message while finishing the workshop, okay?
Okay, thank you so much. It's been so helpful.
Yes, that's the best way to start writing down. Talking and correcting, and then you're going to get the general idea how to do it, and it's going to be easier during the rest of the module.
Oh yeah, thank you so much.
You're
I'm gonna
welcome.
start working on it, and I'll try to send you as soon as possible. Like,
Okay. Go ahead. About the class of yesterday, well, it was a long class, I think.
not really. Like, I remember we had classes that lasted until 9:30, so it wasn't that long.
But it was prepared to, well, in the first moment I presented that class, it lasted around 2 hours because classmates were asking for and making questions that sometimes were without sense. And I said, what's happening here? But yesterday nobody said anything. And I said, okay, there are two choices, or nobody understood, or it was clear.
Like, I have a little, or maybe two or a couple questions, but they're mainly pronunciation stuff.
Oh,
so
okay.
I think it was quite clear yesterday.
Okay, so if I send you x-rays, chest x-rays from your patient, there's not going to be a trouble about reading this, right?
I hope not.
Because that's homework. Start reading lab tests and reading x-rays, well, imaging tests. It's going to be nice.
It's gonna have its difficulty, but I think we're all going to make it through, maybe.
Yes, you can do it. And if there's any questions, send me a message. That's okay.
Okay.
Okay, dear. So see you Monday. Start
See you
writing
Monday.
down, please.
Okay, I
Send me
will.
back as soon as possible the case report, please.
I will.
Okay.
And have a nice weekend.
Have a nice weekend too. Bye-bye.
Bye.
Okay, let me send a message to Karen. Where is Karen? Ahorita le vamos a contestar a la loca. She sent amazing pictures. I like them too much. She's a great one. No, here. Well, I can expect on her. And then let's have a minute. Let's wait. If she comes, perfect. If she doesn't, it's her decision. Hi, Karen. How are you? Hi.
Hi, Miss. Sorry.
No, don't worry. How are you? How was your day?
Very hard. I'm studying and working with
Well,
my
something.
daughter. It's a very hard.
Well, it usually happens now, and having a baby, it's not as easy as sometimes people think, right?
Yes.
Well, Karen, let me ask you, did you prepare the material I was asking for?
No he podido. I can't.
Okay. Let me see. I have a case. Well, I have, let me share my screen. It would be better to show you.
Okay.
I
Please.
need you to prepare it now.
Yeah. Okay.
I mean now, during the workshop for talking about it, okay? Can you
Okay.
watch my screen?
Yes.
You can see a dialogue and then some findings, right?
Yes.
Okay. We have Mr. Hamilton. Just one M. I don't know why I have it twice. Well, Mr. Hamilton, he's retired. He's 72 years old.
Okay.
He's going to the doctor because all of the situations he's talking now. And I'm adding the findings in order to prepare the physical exam. As I was telling you the last workshop, we are start writing down the case report and the physical exam in the correct way in English. That's why it's important to do this exercise.
Okay.
I was asking for a case you are prepared in order to have a knowledge, to be confident with the situation. But if you didn't have time, I understand there is no trouble. Following
Yes.
the dialogue,
The next week I have one exam.
the
It's very
residency
important.
test.
Yes, it's very important because it's very hard.
Yes, I'm sure. I took it 4 times, I think. And I
Yes,
was,
because it's a very, very long summary.
yes, very long
And
summary.
the books is very, very long the time.
Yes, but you are so brave for taking this course and preparing to the residency.
Yes,
It's
I
not
know.
easy.
Yes, uh, um, I do please for to Sunday or Saturday. Can you?
I'm sorry, but according to the paragraphs you write down now, I can send you homework for this weekend because it's not homework.
Not,
I mean, this dialogue and these findings are for practicing how to write down in English. And writing down in English is very different from Spanish.
yes.
In that order, I need your case report and your physical exam done now. And about following the paragraphs you prepare, I can correct you and send you the homework.
Okay.
Is that possible? Because I need it. All of these exercises are the job of this first week. And of course, we have one assignment and we have some quizzes to solve during the weekend. That's why module 2 is hard. I mean, in that order, because we have to write down.
Okay. Can you? I have an idea how I do the homework. Can you? ¿Puedo presentar mañana? Can I present tomorrow or today is?
Do it as soon as possible. As soon as possible, as much as earlier you send the report to me, it would be better. If you do it for tomorrow, that's okay, but tomorrow morning, please, because I have to prepare
Morning?
each case from each page, from each student.
Okay, please,
Okay,
before to 12.
please, before 12,
Okay,
earlier, as earlier as you can. Let me send you two pictures. One giving you the case, well, the dialogue when the patient is talking to the doctor.
okay,
And the second picture with the findings in order to organize the case report,
okay,
all the complaints of the patient. And the second one, the physical exam that you have to write down. Following the example we watched in the last or in the previous workshop, okay?
okay, Miss. Now I
Okay, yeah, give me a second and you're going to confirm that you received it. Give me a minute to send it to you. Which specialty you are choosing? Okay, you have underlined what you have to write down in each picture, okay?
okay. It's the order.
Yes, it's organized now.
Okay.
It might be easier for you, I think, and send it to me as soon as possible, please, in order to correct it and send you the rest of the information, okay?
Okay, Miss.
Don't worry. Okay, did you receive both pictures?
Excuse me. Yes, yes, I have two pictures. Yes.
Perfect. So check them, read them. If there's any question about write it down, follow the guidelines, and you can write down to me a message and I can correct you by writing, okay?
Okay, all the order is some the picture, no?
Well, there are some details in the dialogue that you have to organize in order to write down correctly, but I need you to write down. You have to remember the chronological order of each symptom or sign you find during the evaluation, during the dialogue, and the physical exam is organized. Just try to organize the way you express and the abbreviations you are preparing, okay?
Okay, with the abbreviations?
Yes, if you can use as much abbreviations that we were studying, perfect.
Okay, I'm trying to with the abbreviations.
Okay, don't worry. If there's no possible to use abbreviations or getting confusion, don't use abbreviations now, but in the next exercise we are going to use, okay?
Okay, okay, Miss.
At the beginning, it's harder to use abbreviations. I understand that. And I understand that it's difficult because it's not easy. When I was in the med school, we were learning how to write down in around 1 or 2 months. It's not easy to try to do it in 1 week or 2 weeks.
Yes.
So we are going to catch the general idea, the most important information, and that's all. We don't have enough time to do more detail, okay?
Okay, Miss. Thank you for the time you give me.
No, thanks for your attendance. Thanks for continuing. Ronald is going to continue too.
Yes, but he is yesterday he was was entregó un trabajo.
Yes, he was talking about his final first investigation, right?
Yes, for past one new year.
Okay, it's so hard. It's so
yes,
hard.
And all
Intensive
the
care
time.
unit takes all of your life. I tell you by experience. I was working there.
You don't. You are a doctor?
Yes, I have 10 years in experience about being doctor. I'm emergencist.
Emergency.
Yeah.
Okay. I don't know because I.
No, don't worry. Don't worry. I'm prepared on the emergency room. And around 10 years, I'm working here in Bolivia. I studied in another country. And in my med school, I was in Cuba. And in Cuba, we have 5 years of medical English.
Okay.
So it's different from here. It's different the way we work, but we can do it. Don't worry.
Yes. Okay. Congratulations. I don't know about that.
Oh, congrats to you. You have to catch the residency. Which specialty you are choosing?
General surgery.
General surgery.
Yes.
So brave. That's great.
Yes, I like the
You like action without sleeping,
yes,
without eating, no time
adrenaline.
for running, no time for eating.
Yes,
So brave.
I like blood.
Yes, you love blood. You love that tricky situations.
Yes, I very like.
Yes. No, do it. Go ahead. I hope you pass the test.
Yes, and the exam is this Wednesday.
It's hard. Yes, it's a very hard test.
Yes, because all the politic is very bad.
Yes, it's a politician situation at this moment in this country.
It's very hard. It's very corruptos.
Yes, it's not equal. Yes,
I think I wanna be in another country, but I'm estoy intentando y por eso si no me hubiera ido.
Well, now it's different. Let's
Yes.
try. Let's go ahead. Don't miss the opportunities. Don't let years pass away. Do it. You can do it. Okay, Karen?
Okay. I say to Ronald what about the work because
Okay.
he don't in my home. He was in home that's father.
Okay.
Father's home, and I don't know how he doing the work, but he do.
Okay.
Okay.
Let's try to remind him to come because he's not attending. Now he has 3 absences continuous.
Okay. I talking with him.
Yeah.
Okay.
Okay. So patience. Let's wait. So we're going to take a good test. Don't worry, keep studying, keep reading, but please, I need your homework now.
Okay. Okay. I do the more late more fast.
Okay, do it as faster as you can. It would be better, okay?
Okay, Miss. Muchas gracias.
No, don't worry. Don't worry. You are in confidence. If you
Okay.
need something to support, if you have any doubt, send me a message and I can answer to you. Don't worry. That's my job.
Okay, Miss. Thank you for comprehension. Comprehension.
Just for being
Mucho
comprehensive.
tiempo que no hablo inglés, entonces estoy un poquito fuera de práctica.
It happens. Don't worry. Don't worry. That's okay.
Yes, I'm put in the current.
Yeah. Don't worry. You are now focused on the residency test. Don't miss that objective, but let's try to work on this too, okay?
Okay, Miss.
Okay, so see you Monday.
See you at the Monday, Miss. Have a nice weekend.
Thank you so much. You too. Have a nice weekend, Karen. Bye-bye.
Okay. Bye-bye.
Well, she's Michaela. She's my lady, my baby. Tonight she's with me. She just arrived. She was late. But well, let's wait a little bit. Now it's the moment of Juliana. Well, Juliana is now working. I know this. But well, she didn't tell me anything. Let's wait a little bit. She still has time. But if she cannot attend the workshop, patience. Maybe she's into an emergency again. So don't worry. Let's wait a little bit. I'll be back. I'll be back in a few minutes. Well, now it's Alejandro's time. I lost him. Yes, Alejandro's time. He is not yet. Let me give him a minute. I'm gonna send him a message. Yes, he's here. Hi, Alejandro. Hi. Hi, Alejandro. Can you listen to me?
Hello. Yes, I can listen you, teacher, doctor.
Oh, perfect. Yeah, you're showing me your homework. Yes.
Okay. Yes. Well, there is my case report. I
Yeah.
write like a 9-year-old boy presented to the emergency department complaining of a stomachache in the right iliac region and fever. Okay, so and on examination, temperature is in 38.1 centigrades. The heart rate is 115 per minute, and blood pressure is in 100 over 70 millimeters of mercury. I don't know how to say that in English. All the blood pressure, how they present. The abdomen is not distended. There's no dullness at percussion, and it is with pain when touched the right iliac region, and it feels rigid. I don't know, as that was the thing that I write.
But that's okay. Let me open your file.
Okay, it is the same picture of this.
Yes, yes, I received your picture and that's perfect.
Okay.
Give me a minute, it's opening.
You're with your child.
No, don't worry. I'm with my baby. She's Michaela. She's the youngest.
Okay.
She's 11 months. We are going to celebrate her first year.
Wow.
Days. Ah. She's running me crazy. Okay, can you watch my screen?
Yes, I can.
Perfect. Okay, how many times he's with the stomach ache?
Sorry?
Okay, that's okay. The way you are introducing the patient, how you start writing down. That's perfect. You catch the idea. A 9-year-old boy presented to the AER department complaining of stomach ache in the right iliac region. Okay, how many times, how many hours, days he was with the stomach ache?
Okay, I didn't put the time, but like 8 hours.
Okay, just, okay. He's with stomach ache or abdominal pain. Stomach ache is for patients, but for doctors.
I was in confusion with that because I don't know, in this part I only write for a medic and not for like the patient referring me symptoms.
So no, you write down with medical terminology.
Yes,
you use medical terminology. Okay, patient is
maybe
going to
stomach ache is more used like for reflux or problems in the stomach.
Okay, stomach ache, it's for patients. It's a term used for patients, not for doctors.
Okay.
It's popular term, the social way of talking. You have to say abdominal pain.
Okay.
Abdominal pain or something like that. Well, abdominal pain is a medical term, but you have lots of synonyms in social English. Could be a stomach ache if it is just in the middle, well localized, but when you tell me the right iliac region, it's out of the stomach, it's far away.
Okay.
So correct it. to abdominal pain and at the time the patient is in pain, okay?
Okay.
So with that, it's gonna be perfect.
Okay.
On exam, temperature, heart rate with 9 years old, well, could be BP, yeah. The abdomen isn't distended. Okay, when you have negative information, you have the opportunity to use some abbreviations. Well, you were not present in the last workshop, right? You couldn't
No, I
attend.
wasn't.
Yes. Well, let me show you an example of this. I know it's not great. That pictures are not great to watch. Yes, she's one of our classmates. She's a gynecologist, Dr.
Oh.
Pamela. And she's amazing. She was showing me her case report.
Mhm.
Okay, we have this. This is the important picture. Well, I'm sorry. When you have nothing to explain about the physical exam, you
Uh-huh.
use this abbreviation, NAD, nothing to add, nothing added at the moment, negative data, it means.
But I can put like percussion, inspection, and that NAD.
Yes,
And
you have
that's
to
it.
organize the idea. Let's see your homework. Give a minute. Okay. The abdomen, well, abdominal evaluation, you can say if you consider it necessarily, or just abdomen and 2 points and continue writing down. Okay, inspection is negative, not necessarily to write down. No dullness as percussion, you get away. Pain when touch. Okay, impalpation, we got pain or painful palpation in the right iliac region and lead and rigidness, and that's all.
Okay.
Try to take a brief paragraph. As much paragraph in medical term, it could be better.
Okay. Also, I try to be short one, but
No, that's perfect. That the way you are writing down is correct, but you're thinking in Spanish when you give this explanation. So don't worry. That's a good way of starting writing down and understanding how to make a clinical, an examination report.
okay.
Oh,
Also, I have a question because
yes.
I don't know is when touch is right or I have to put like when
On
when
palpation.
it's touch or okay. On
On
palpation.
palpation. The medical term. On touch is for social, for Legos, for non-medical personnel in general, not medical people. But you
Okay.
have to talk just with medical terms. Do you remember you were talking to me and told me you were watching the histories of American doctors in your country?
Yes.
If you get the opportunity of reading one paragraph of them, everything is in medical term.
Yes,
Everything. Non-social expressions, non-words that could be understood for Legos, for
okay.
non-medical people.
Okay.
Just med terminology. In that way, your diagnosis is appendicitis, I mean?
Yes. Yes.
Okay, that's okay, but that's okay. In kids, appendicitis, it could be in that way. But in kids, according to the chronological Murphy's history, could be try to complete to full term this. Don't worry, that's okay.
Okay.
Just a suggestion I can give you. You can give more details, maybe more anatomical details like Robson technique, lens technique, and all of this, okay? If
Okay.
you find that information in kids, perfect. Just
Okay.
correct that small details I'm explaining to you, write it down again, and send me again the picture.
Okay. I will do
Following
it.
the corrections, following all these details, I can send you the homework for continuing with your case.
Okay.
At the end of the paragraph you rewrite, please remind me the diagnosis for not mixing the information.
Okay, that's fine. I will write it.
Okay, let me share you this screen for showing you how to explain these details.
Okay.
In this slide, well, in this picture, we can see the OE on exam. The temperature is always in the British medical report, medical exam, the physical exam report is the first data you have to collect, to write down. In the British one, in American one, you write down all the vital signs.
Okay.
Okay, that's the difference in the chronological order of, well, that's a detail in the way you write down, but it's the same in essentia, yeah.
Okay.
So you describe the findings, just going to the point, like this: smooth, firm, 3 by 4 centimeter mass in right supraclavicular fossa. For example, you have the chance to use an abbreviations like this, use that. Don't worry, I'm gonna understand the paragraph you write down. Just use as much abbreviations as you can.
Okay.
Practicing and getting used to do it.
Okay.
Then that's one finding. You have another finding, nodes 1 to 2 centimeter in diameter, palpable in both axial and inguinal iris. So you can see it's like a resume. Extremely brief and then goes to the point. For this case, with this diagnosis, it's important to describe oropharynx NAD. It means nothing a detail, no detail, nothing important, nothing to add. It has too much meanings. It means that it's a negative exploration. But if with your pathology, it's important to explain a system, to support that you evaluate that system, write down which structure is and the NAD, because you checked it. If you have positive data, like in your case, you can see abdomen, ABD, and then all the findings organized, following the chronological order: inspection, auscultation, percussion, and palpation, right? But you don't have to explain me which technique you used. On inspection, if you tell me abdomen not distend, I understand, I infer you made the inspection. I know this because you are supporting, you checked it.
Okay.
So you can see it's a very brief paragraph. Don't worry about that.
Okay.
Okay.
Yes.
I'm gonna send you the. I sent it to you, right?
I think you. Yes.
Yes, I sent it to
me.
you when we were talking about it. And just correct the paragraph you have until this moment, and please add the diagnosis, and that's all.
Okay. That's one. Okay, I will do it.
Yes, please, as soon as possible, please, because tomorrow morning I'm trying to finish all the lab tests and rest of the studies. I'm going to include in each case of each student. And then according to that information, you're going to report all of the details we need.
Okay, thank you.
It's
I will
gonna
do
be
it
a
right
nice,
now.
it's going to be a nice job.
Okay, thanks.
No, you're welcome. You need to practice writing down. It's important. For module 2 is objective by planet. We can do it.
Okay, and I need to for my test.
Yes, you need to practice a lot. Thank
Okay.
you for your pool. Tell me, are you reading the articles I'm sending to you?
No, I haven't.
Okay, you didn't have time to do it.
No, but I
Okay.
will tomorrow. I hope.
No,
Because
don't worry.
I'm traveling a lot, but I'm gonna make time.
No, don't worry. I'm asking you that because you're going to see a different structure about writing down an article than writing down a clinical history. Of course, are different papers, are different ways of writing down, different grammar rules or structure rules, I mean. And maybe you might get in confusion comparing this information, of course. It's
Okay.
different, the order for supporting data. We are going to check that part at the end of module 2, because we study the structure of articles. And you're going
Okay.
to study it's very, very different.
You want milk?
He wants to talk here. No, don't worry. So go correct it and I'll wait for your pictures, okay?
Okay, I will send you to you.
Perfect. Thank you so
Okay.
much, Alejandro.
See you. Thank
Bye,
you,
see
doctor.
you Monday. Hi, Denise.
Hi,
Hi, how are you? How was your day?
can you see me? Yeah.
Yes, I can watch you. How was your day? Everything okay?
I think so.
Okay,
Kind
I
of,
sent you
kind of
some
peaceful.
messages explaining you about the activity we have now. Did you have the
Yeah.
opportunity to check them?
Yes, of course. And already send it to you the case report that I made in a
Okay,
picture
perfect.
your personal WhatsApp.
Perfect. Let me
But I
open the
but I
WhatsApp.
can read it to you also.
Okay. Here's my lady. She's 1 year old. So patience,
Yeah,
please. I'm sorry.
there's no problem.
Okay. These workshops are very useful at this moment because we are going to write down a lot.
Okay, that's good.
Okay.
I
Let
need some
me,
practice for this.
yes, it's important now. Let me share the screen. Can you watch my screen?
Yes, that is my
Okay. Please
my
start
intention.
reading your own case.
Okay.
We are going to correct
Um,
it together, right?
Okay, all right. It's a 22 years old woman. The complaint of malaise and occasional dysuria since 2 weeks till now. Also had noticed leukorrhea in the groin the last 4 days. The examination, physical examination, it detects temperature 36.8 of centigrade,
Sí.
pulse 82 per minute, blood pressure 110 70.
Okay.
The oral
Let's wait a little
examination.
bit.
Okay.
Let's read this part, the vital signs again. Temperature,
Okay.
36,
Temperature
36.8 Celsius
36
degrees.
Celsius degrees.
Yeah.
Okay.
The pulse, 82
per minute.
beats per minute.
Beats per minute. Okay.
Yes, the abbreviation of this is not this one, it's BPM.
Okay.
When you get slash and min, it's for races, for sports, not for medical purposes.
Okay.
In Spanish, it's correct, but in
BPM,
English, it's different. Okay.
beats per minute.
82 beats per minute. About the blood pressure, 110 over 70.
Over
Yeah.
70.
Yes,
Okay.
perfect. Let's go ahead.
Now the rest of the physical examination, oral exam, no abnormality detected, right? Cardiovascular system, respiratory system, central nervous system. There are no findings.
Okay.
Nothing to add.
Yeah, nothing to add, no findings, nothing important. Perfect.
Now the positive findings are in the abdomen, suprapubic tenderness on palpation and pain at the right flank during deep abdominal palpation. Also, an external examination of the genital zone does not detect any fluid or abnormality in the skin.
I'm sorry, my baby is trying to give her opinion. I'm sorry, she's 11 months, and well, now I'm with my 2 kids. Today,
Yeah, I understand that.
No, I'm sorry. Well, let's correct a little bit. This first paragraph is perfect. I like it too much because you are the first one who made it complete with all the information and the grammar structure we were talking. Congrats for that. Thank you.
What the paragraph that I'm trying to describe the symptom of the patient.
Yes,
That one
perfect.
is the good one. Okay.
It's a good one. It's
Okay.
a clear case report. Here we don't have anything to correct or to change because you followed all the structure rules that we were talking in last classes. So that's perfect.
Okay. So the problem is in the physical exam.
About yeah, well, there's not a problem as a big deal. I mean, for example, if you have this negative data, cardiovascular, respiratory, and central nervous system, and it's not a specific topic to evaluate because it's not related to the pathology you are proposing in your diagnosis, you don't need to explain that there is nothing, no findings or nothing to add at the moment.
It's not necessary.
Not necessarily.
Okay.
Which diagnosis you are proposing now? Which one is your diagnosis?
My diagnosis is urine tract infection.
Perfect. When you talk about urinary infection, well, you don't need to evaluate cardiovascular system or respiratory system. At least you are getting into shock, right? A septic shock.
Like a pyelonephritis. How do you pronounce that?
In a pyelonephritis, well, if you have, for example, tachycardia, tachypnea, or something like that, then you can add the information that the systems are not complicated at the moment.
When we were thinking on sepsis, probably.
Yes, if you have findings that are related to the system, then you describe them, okay? If there is not that situation, don't worry. It's not necessary to explain these details specifically.
Okay.
So avoid all of them. OE means on exam. This on exam, if you said nothing to add on this abbreviation, you're telling me that you have no findings in the complete exam.
Okay.
So this abbreviation is out of order at this moment. We don't need this. Of course, we always have a finding. So we don't have to use this information because it's getting in contrast. It's the opposite on the ideas you are supporting in this part.
Yeah.
So avoid this NAD and this.
So I can resume. I can make a resume of all of the systems that have no abnormalities.
Yes.
With
rest without.
OI.
Yes. At the end, you can add the sentence. Rest of the evaluation without findings, and that's all. You support, you evaluate all the systems.
Okay.
So don't worry about it. Oh, palpation and pain in the right flank during the abdominal palpation. Okay, suprapubic tenderness, perfect. This on palpation is out, is added, but it's not necessarily at the moment. Suprapubic tenderness, we know that by palpation, we get if it's with tenderness or not.
Okay.
You can, for example, you can say suprapubic tenderness and pain at the right flank during the deep abdominal palpation, and that's enough.
Without putting that, okay, yeah.
Okay, an external examination, no, an external evaluation of the genital area. Does not detect any fluid or normality in the skin. Okay, the genital and urinary system is evaluated by inspection. So if there is no findings, don't add it. Or you can say genital area without findings. That's all.
Well, I told that if she is telling me that have a low Korea, I told that it was important to be clear that I examined that area.
Yes, in that order,
So,
you can support this, saying this, for example, genital area without findings. That's all. And then another sentence, an extra sentence when you say rest of the systems, rest of the evaluation without pathological findings. That's all. Try to make a brief, as brief as you can. For example, in this part, it's great. You are being clear that you evaluated the genital area, that you got that detail in count. You didn't miss the information that the patient is talking about. But it's not necessarily to explain that there are no findings. That's the NAD. This abbreviation is giving us that information and avoids all the rounding information.
Okay.
So that's okay.
With that,
I
I'm
like
making
your
a
job.
redundancy.
No, don't worry. I like your job. It's clear. It's going to the point. Just there are a few details to correct on the physical exam. So correct them, write down again the physical exam with the corrections we are talking now, and then send me again a picture, and that's all.
Okay.
According,
I will do it right now.
Now remind this, when you talk about a urinary infection, you have more signs to evaluate. For example, the lumbar percussion.
That is one of my questions. How do you say that? Percussion.
Yes, you got it. The
good.
lumbar percussion, and you can get how painful is that, and then you gotta focus. You have the pieloreno-ureteral points, right, in the abdomen.
Yeah, that is what I'm trying to make it clear in the examination when I put the suprapubic tenderness. But yes, how do you say that? Okay, again, please.
Pieloreno-ureteral points. The same as in Spanish, just changing some letters, getting the med terminology with the grammar in English. That's all. Lumbar percussion, pieloreno-ureteral points. What else? And I think that's all, the most important ones. At the moment, your patient is without fever, so taking her vital signs, it's without any complication at the moment. So don't worry. According to the corrections you make, information you can add about your clinical case, please at the end, add the diagnosis, just for reminding me the situation. And then I'm gonna send you some lab tests and some studies that are necessary for each case. Okay. In your case, you are going to send me back the lab reports, the readings of the lab reports. That's the homework of this weekend.
So you're going to send me a lab report, and I'm going to resend you
the answers,
reading of that. Okay.
Yes. So in that way, first of all, correct the information you made now, the physical exam we are talking about. And according to the findings you describe, I send you the lab reports, I don't know, ultrasound reports, everything I consider necessary in this case. And then you send me all your conclusions and readings and everything about it. You are going to write a lot this weekend.
Okay, I kind of, how do you say that? I kind of agree with that. I'm okay with that. I don't know.
Agree with that.
But I think you understand.
Yes, I understand. Don't worry, Denise. That's the first step for writing down. That's the way we have to learn how to do it. Okay?
Okay. Well, thank you.
Let me send you the poll to take your attendance. Yes, it's done. Okay, if you can add more abbreviations, do it, okay?
Mhm.
Thank you
Well,
for the poll.
I will see. Well,
Add as much abbreviations as you can. That's the best part. I'm gonna understand the case, don't worry about it. If there's any question, I'm gonna send a message, please translate me this abbreviation, but I don't think it would happen. Don't worry about it.
Okay, well, thanks and have a good night.
Thank you so much. Have a good night too. Okay, Dennis came and he made homework and that's amazing. Luis sent me a message. He's going to come late because he's out of his city at this moment. He's traveling. So I'll be back in a few minutes. Give me a minute, please. I'll be back. Well, now we are expecting Ivana. Ivana might come in 1 minute. Let's wait a little bit. Hi, Ivana. Hi, Ivana. Can you listen to me?
Hi.
Hi,
Yes.
how are you? Hi. As you can see,
It's my turn.
yes, it's your moment. It's your
Okay.
time.
No sé por qué se
Now, now I'm with company. She's Michaela's my baby.
nice to meet you, Mikael. Hola.
Yeah, she's 11 months and she's hungry. Okay, Ivana, did you prepare the material I was asking for? The case report and physical exam?
Yes, I have to share my computer.
Yes, your screen. Let me get it available. Yes, can you share your screen now? Is that possible?
I will try it.
Okay. Perfect.
Can you see my
Your screen, yes.
screen?
I'm watching this.
Okay.
Okay. Let's read this.
I don't know.
Well,
If-
that's not the way we are writing down at this moment, but you are a step ahead, I mean.
only this
Yes.
have been.
Yes, let's start with this and then the pathological, well, the physical exam.
Okay. I learned read.
Yes, read this, please.
Okay. Chief complaint cough of 3 days of evolution. Current medical history. The mother of patient, the patient is 5 months. The mother of the patient refers that her son was previously healthy and 3 days ago he gradually began to have a nasal congestion in moderate amount, accompanied by sneezing, for which she gave him Winazor, 10 drops once a day, with which he did not improve. After 2 days, non-productive cough that worsens. At night, the mother presented to her general practitioner. I remember that. Who began symptomatic treatment with Rodiplox, 10 drops every 8 hours, which does not improve the symptoms persists, and now he has a respiratory distress. So she decides to consult. And exam the physical exam. By on exam, patient alert active in fair general condition. Supine position, regular health status, heparin cell on the back right hand encephalic chamber at 10 liters per minute with adequate oxygen. Vital signs. Heart rate 130 times per minute. Blood pressures 95/54. Respiratory rate 40 times per minute. Weight 8 kilograms. Size 59 centimeters. Core temperature 37. Blood oxygen 96%. Local inspection cardiopulmonary. Rhythmic and synchronous heart with pulses. Murmurs are not heard. Symmetrical and expandable chest with a slight subcostal rotations. Lungs with decreased air intake bilateral bronchi. Inspiratory stressor is evident without the use of a stethoscope. I finish.
Okay. The diagnosis you are proposing
Group.
is, which one is your diagnosis?
Group.
The group, okay.
Group.
Laryngotracheitis. Acute laryngotracheitis. Okay, let's go to the beginning, please, to the chief complaint, to the case report, in fact.
Okay.
Okay. Well, you can make it with that mark. Yeah, we can blacken it. That's okay to remark the chief complaint. That's perfect. We generally do it in Spanish, but in English, you can write it down. That's okay, because we are talking about a baby. And when you talk about a baby, you have a different way of writing down. It's different from adults, but that's okay. Do you remember we have some rules for reading, for preparing the case report, the guidelines I sent? Like talking in past time, being chronological in order, and that kind of things.
And this is in chronological order.
Yes, it has chronological order. The medication you are describing is related to the situation that the baby is suffering now, and that's okay. There is no trouble about it.
Okay.
But we have to correct, because it is talking in present, in many at the beginning, and all of the paragraph has to be in past.
Okay.
The mother of the patient, it's better to say the patient's mother referred that her son was previously healthy, that her son started gradually with nasal congestion in moderate amount, with nasal congestion, or with moderated nasal congestion.
Started where I put.
Okay, let me tell you the possible resume. We can correct it, because you are thinking in Spanish when you write it down. Okay. Why I get that idea? Because you're rounding ideas, you're rounding meanings and definitions. In that order, when you write down in English, you have to avoid that way of talking, and you are able to go just to the point, making a resume of all this information. For example, if you say he was previously healthy and 3 days ago he gradually began. Now it's in Spanish. It's a Spanish expression that way. No, it's not English way of talking. So, but don't worry, that it's not wrong. It's the way we are learning how to write down in English. Okay.
Okay.
Let's do this, Ivana, because let me read how it could be. And then I need this file to my WhatsApp. Can you send it to me to my WhatsApp now?
Okay. I will send a copy.
Yes, perfect. Send me a copy and I'm gonna download it and we are going to correct it together. Oh, we have 5 minutes more.
Okay.
Okay, just the details we need. The differential diagnosis is okay, but you have to support why it's differential. But now it's not the objective of this workshop. Don't worry. Yum, yum, yum. Let's correct it together. And well, with the corrections, with the details we are going to change, you are going to correct the file and send me a second file. Yeah. With that second file, yeah, we can work.
Okay.
Okay, perfect. I just received it. Okay, let me download it. No. Okay, please let me share the screen now.
Okay.
Okay, and now I'm gonna share to you the file you sent me, okay? Okay, can you watch my screen?
Yes.
Okay, let's work on this. Hey, what happened? Okay, let's do it again. It's running math. Okay, can you watch again my screen?
Yes.
Okay, give me a minute. That red underlines run me crazy. Let me change it to English. Okay, perfect. Okay, this part is not necessarily, just avoid this. You talk your current medical history. Yes, could be it's a child, could be in a child, not in adults. The patient's mother refers, well, referred because you're talking in past. That her son was previously. Give me a second, please. Okay. Refer that her son was previously. Yes. This is not necessarily was. We're going to change it on place. Her son gradually began with nasal congestion.
And 3 days ago, it's not necessary?
Yeah, but it's not the place. We are going to correct it. Give me a minute, please.
Okay.
Ah, we are almost on time. Give me a minute to. Okay, let's write it again. Patience, mom. In order, we are almost on time.
Okay.
Yeah.
But
That person started or began with nasal congestion, with moderated nasal congestion, sneezing. Okay. 3 days ago. Yes, that's all. You got a resume. With all of this expression, it's a little mixed, but it's the way to reorganize the idea and giving the information we really need. She administrated by herself. She decided to administrate this, right?
right.
By herself, Minasorb, 10 drops once a day. It's important because the baby is getting worse. That's why we talk about medication. If there is no relationship with the medication and the actual situation, we don't have to talk about it without improving. Without improving, after today is not productive. Without improving. The baby started. Well, we are out of time. So let's do this, Ivana. Let me correct the file. I'll send you back to check again, and you're going to complete some corrections about it, okay?
Okay.
And according to the paragraph you make again, you write down again, we are going to work, okay?
Okay.
This weekend, according to the clinical case you send me to this medical situation, I'm gonna send you lab tests, X-rays, many details from a patient similar like yours. In that order, that's gonna be homework, okay?
Okay.
Thank you so much for your poll. I took your attendance, and please give me around, well, while finishing the worksheets, I'm gonna correct it, and then we're going to, well, you're going to see my suggestions to check it again, okay?
Okay, thank you. See you.
Okay, see you, Ivana. Thank you so much.
Yes.
That's an interesting case.
Okay.
Okay, bye-bye. See you Monday. Hi, Natalia.
Hi, teacher. Good night.
Hi, how are you, Natalia? How was your day?
It was a great, teacher. What about you?
A full day again, but everything's okay. Okay. Do you remember I told you I'm gonna prepare a case for you? Yes, I did it. Yeah. You can do it. Now I'm with my kids. The big boy is Joaquin. He's with me. He's my teenager.
Hello.
He's learning how to speak in English.
Oh,
He is by practice, just listening to me. And my baby is getting in another way. She's having fun.
Oh,
no, well, tonight we are out of babysitter, so there is no trouble. We can stay together. Okay, can you watch my screen?
Yes, me.
Okay, we have this case. He is Mr. Hamilton. He's retired and has 72 years old. You have this dialogue, okay?
Okay.
reading this dialogue, you have the chance to make the case report. Can you write down it now? Handwriting in Word, that's okay for me.
Right now, teacher. Okay.
Yes. Do you remember we have the guidelines, right?
Yes, miss.
Following that guidelines, write it down, and we are going to correct the possible mixing information, the way of making the case report resume, and then organizing that idea, we are going to be able to check the physical exam, okay?
Okay, teacher. Do you prefer handwriting or in a Word or a document?
That's okay for me. There's no trouble. Because
Okay.
now we are going to talk about your paragraph. So start doing this, and when you finish, please let me know. I'm gonna stay here, okay?
Teacher.
If there's any question, please let me know. There's no trouble.
Okay, miss. Thank you.
Okay, how is it going, Natalia?
I think, well, teacher, I don't know how to write the start.
No,
How
don't,
can
don't worry.
how can I
Don't
say
worry.
he had cow for year?
Yes, could be. Let's write down. Do you have something written?
Yes, miss this.
Okay. Let me share you. Well, let me now share your screen, please. I'm gonna stop and let's read your paragraph.
Okay. Can I show you? I was writing.
It was written. Written, okay. Oh, yes. Good.
This is
Perfect.
oh,
A 72-year-old retired man. Perfect. Who has been?
with coat.
Yes, with cough.
And then is what else? I should add
Don't worry.
the sentence.
Was how long? 3 years. Oh, got been with cough for several years. Could be.
For several years.
He with several years periods. Now
Okay.
he says now or during the appointment he said it was productive cough with yellowish phlegm. Without
He said
he has productive cough.
Okay.
With yellowish phlegm. Maybe you wants to give her opinion. Okay, with yellowish phlegm, without blood.
Without blood.
Moreover, he said,
Teacher, I need to write it continuously or
we are going to organize it again, don't worry.
What, miss? Sorry.
Which place you are?
Without blood.
I'm sorry, my baby is taking the connections. Okay. Moreover, he said he had shortness of breath. That's all. Shortness of breath. Okay. Until this point, let's talk about it. Do you remember we had some guidelines to talk about the case report, right?
Yes, me.
Okay, let me share the screen. Just for taking it in count, the general data of the patient are great. It's well done. We got the chronological order in the lines I'm telling you.
Yes.
And the symptoms that the patient said. We are not talking about treatment. That's okay. And I think everything is in past, right?
Yes, me.
In that order, we got this information. Following the information I told you, try to organize it into one paragraph, okay? Moreover, can you watch my screen, right?
Yes, me.
We have these findings about this clinical case, this case report. For example, the vital signs, the saturation of oxygen, 89% in free air, respiratory rate 24, heart rate 78, and everything.
I am seeing the guidelines. Yes.
Yes, I was not sharing the screen, I'm sorry. Okay, now we have these findings during the physical exam.
Yeah.
These findings are the ones you have to follow or to write down in the physical exam, a similar chart that the one we were working in the last workshop, okay?
Okay.
Following that information, just send it back to me, and that would be nice.
I have to add this to the case report.
Yes, I'm gonna send you 2 pictures with the case, with the dialogue to your WhatsApp in a few minutes, and then the findings.
Okay.
You have now the general idea about the report I was telling you. So organize the idea in order to make a brief paragraph. Okay, try to resume it more. Okay.
Okay. And the vital signs, the last part you told me, I have to add it at the end?
Yes, you have to explain me the physical exam following the chart we were working on the last workshop. A similar one with the findings I'm telling you.
Okay. Okay.
When you finish this, send me a picture to my WhatsApp, and I'm going to send you back the correction if it's necessary. If everything is okay, I'm gonna send you the lab tests and x-rays in order to complete the information about this patient, okay? That's gonna be the homework of this weekend. It looks easy, but it isn't, yeah.
Yes.
And I'm sure you're going to do a great job, don't worry.
Thank you, Miss. I will try.
Yeah, you can do it.
Okay, teacher, thank you.
Okay, Natalia, thanks for your attendance. Thanks for your poll. I took it. So while finishing the workshop in, I think, around 30 minutes or 45 minutes, I'm going to send you the pictures, please. Okay?
Okay, Miss. Thank you. Goodbye.
Okay, so goodbye. Hi, Luis. How are you?
Hello, teacher.
Hi, can you listen
I'm
to
fine.
me?
Yes.
Perfect. I cannot listen to you very clear, but well, patience, don't worry.
Yeah, in a trip with my family. We are now in the bus.
Okay, you are far away from the city, I mean.
Sorry. Excuse me?
Well, maybe you are without a good internet connection. Internet. I hear too much voices. I'm sorry.
Yes.
Well, don't worry, Liz. Did you prepare the case, the information I told you?
Yes, but it is very. I'm going to send you now.
Yes, send it to me by WhatsApp, okay? And then I'm gonna download it and we can talk about it.
It's just a image. I wrote it.
Okay, give me a minute to download, okay?
Okay.
Okay, perfect. I'm opening the file.
It's very small. I couldn't make it.
No, don't worry, that's okay. You made your effort. That's okay for me. Give me a second, please. It's uploading, okay?
Okay.
aquí mucho?
Okay, Luis, can you watch my screen?
Yes, yes.
Perfect. It's your patient, a 25-year-old male patient who consulted for pain in the right ankle. For 15 minutes of evolution, okay? Patient
Yes.
suffers forced inversion of the right ankle. Oh, poor one. After which it starts with pain. Okay, 15 minutes ago, perfect. On exam, the patient presents vital signs. Okay, that's okay. Beats per minute, breaths per minute.
I didn't understand that. It's breathe per minute and is the beats per minute.
Yes, beats per minute and breaths per minute.
And
That's
breaths
okay,
per
that's perfect.
Yes, I put that. It's a case of, like about trauma, about orthopedics.
Yes, okay, let's read about it. This first paragraph is correct. It's well done with the general information in past. But here, patient while playing soccer maybe could be better. Use that connector. While playing soccer, suffered forced inversion of the right ankle. Yes. After that, he starts with pain. Yes, after that.
Okay.
And patient while playing soccer, patient, comma, while playing soccer, comma, suffered forced inversion of the right ankle.
Okay, it's in past, right?
Yes, it has to be in past. Yes, this verb, the suffer verb, has to be in past. Because we are talking the situation that happened minutes ago. It's not in the present suffering the situation.
Okay. In
Just
Spanish,
change it.
sometimes we are talking about paciente sufre like that.
Yes, you have this expression because you are thinking in Spanish, but don't worry, it happens. You are starting learning how to write down this way in English. That's normally to write down in this way. Don't worry. Patient, comma, while playing soccer, comma, suffered forced inversion of the right ankle. That could be better, I think. Comma, after that, he starts with the pain. That's all. On exam, this part, the patient presents, you don't have to use this expression. The patient presents. It's not necessary to do it. Why not? Because you are evaluating the patient. It's indeed. You don't need this. You have to take it out, okay? On exam, go to the second line. Vital signs in a full line, perfect. Normocephalus, it's not necessarily, but you can write it down if you consider it necessarily. Well, going to the point. No, don't worry, you have a great job, but going to the point, let's punctualize this. If you have all of these systems that are not related with the pathological situation, with the history that the patient is suffering, you don't have to write them down. The NAD, for example, cardiovascular system, nothing to add, right?
Yeah.
If the cardiovascular system would be related to the situation, to the case, then you have to support that you evaluated that. But in this case, you don't need this information, this rounded idea.
Yeah, that's right.
Yeah, please.
When a patient suffers,
or pharynx, cardiovascular, respiratory, and abdomen, they are not related to the situation the patient is suffering. So just avoid it. You can say right limb or right ankle in the way you started, that's okay. And then you describe edema, tenderness, ecchymosis, open wounds, deformity, crepitus on palpation in the lateral. Yes. And the external malleolus could be?
External, yes, it's a, you can use,
Yes, could say external malleolus, internal malleolus, that's okay for me. It's your choice. Is that possible to walk?
no.
Okay, so you have to add that information because the patient cannot stand,
yes,
cannot stand up, cannot walk, cannot move by himself, right? In that order, just add that extra information. With that, that's perfect.
Okay.
Okay, X-rays. Well, it's an extra explanation about it. You have a fracture, perfect. But this information at this moment, it's not important. We are not talking about X-rays at the moment. Until this point, we had to write down, but that's okay. You send it to me. Don't worry, that's okay. Okay, Luis, in that order, please correct all the details we are talking now and send me again the picture, okay?
Okay.
According to this situation, so according to your case, I'm gonna send you pictures. If it's, well, this, in your opinion, this fracture is surgical or not?
Yes.
It's surgical, right? So
It's
I'm gonna
surgical.
send you some lab tests, some X-rays, and you're going to give me the readings of them. It's gonna be the homework of weekend.
Okay.
Okay.
Do I have to put sorry,
I'm going to give you as a guideline where to write down or how to write down this new information. Don't worry about it. Don't worry. Be patient. Be patient. All the information that I'm telling to you. Okay, that's okay. But you need a sentence here supporting. For example, lab tests showed, and then you give me all the readings. X-rays show, X-rays revealed, and give me this description is perfect. And with that, we have all the information done. In that order, we can work, okay?
Okay.
So don't worry, that's a good job. Congrats, you made a good case. Is there any question about it? Something not clear, maybe?
No.
I don't think no, right? It's clear and you got the general idea how to do it. And you got a traumatic patient, a fractured patient. When I was working in my last hospital, I had lots of these patients like this one. It's a very common situation.
Yeah.
But please add information that it's not possible to walk, not possible to stand up, not, what's the expression? Not voluntary movement, just involuntary movement and painful movement, something like that. Organize the idea and do it again, okay?
Okay, when do I have to send it to you?
As soon as possible. Maybe if it's tonight, would be perfect, but according to the information you get corrected, I'm gonna send you back the information, okay?
Okay.
If I don't receive your paragraph, your corrections of the case, I don't have a way to send you back the information. I need it.
Okay. No problem.
Okay, thank you so much. You made a great job, Luis. I'm proud of you. I'm sure you are doing a great job.
Okay, thank you.
Okay, can you watch the diary, please?
Yes.
Okay, perfect.
Okay.
Okay, correct the details I was showing you. Thank you for the poll. Your attendance is done. And send it to me as soon as possible. If you can do it today, it will be perfect. But if it's not
Okay,
possible,
sounds
please
good.
tomorrow, no more than tomorrow, please.
Okay, no problem.
Okay, so thank you so much and see you
Thank you
Monday
to
in
you,
class.
teacher.
Bye
See you.
bye. See you.
Bye bye.
Bye bye, Luis. Yes, that's perfect. We are almost on time. Just one student more, and he's one of my best students. I hope he can attend the class. I'm still whipping it. My babies are in my room, so let's wait. Okay, we are expecting Dr. Consemaita. He's supposed to come now. Let me send him a message. Let me send him the message because he said he was able to come at this moment. Let's wait a little bit. Yeah, it's not attending. Let's have some patience. Well, let's wait a little bit. I'll be back. Hi, doctor. Can you listen to me?
Hi, Iris.
Hi, how are you?
Oh, exhausted.
Yeah, I think it's not easy.
Yes. Today was special.
Oops, it was a hard day.
Yes. Harder than the others, than usual day.
Yes, it happens. It's very usual in your specialty.
Yes. No, besides, it's about we are in trouble in the La Caja Nacional because the CEO wants to move our accounts, personal accounts, where they pay us to the bank, to the Union Bank, to the Banco Union, no? Instead BCP. And we don't know.
It's
Yes,
inconvenient.
exactly.
Well, but
We
it's not
don't want that.
correct.
Yes.
It's not possible.
Everything is like a political issue. But it's difficult, and we are in different reunions, meetings about this. And I was in three meetings about that with Banco Union, with BCP, between us. It is difficult, this. And apart my patient, I want to finish my term, no, in the CIMRA, but I don't have any time.
Just few months more and that's over.
Yes, I hope so. It's 2 until June. But
It's June.
I
4
can.
months, 4 months. Let's keep in
Yes,
mind.
4 months left, but no, it's
And then
difficult.
you're going to travel, so you're going to have free time of it.
Yes. And besides, I have to take a test tomorrow because I don't know how to say postular.
You have to present.
Yes, I have. I presented in the at the in la UMSA in the neurologic signature for yes
for teaching at the university.
Exactly, for teaching
That's
university.
amazing.
Yes, and tomorrow is our last test. No,
Wow.
Yes, I have to prepare about a class. No, about reflexes and cerebellus function, and well, tomorrow is going to be decided about that.
Yes, so
And
in that order,
in that
you're in a
order,
mess.
yes. This tonight is gonna be harder than the day.
Just to finish preparing all the material.
Yes. I in order to that, no. I have to travel tomorrow to Cochabamba about this travel, about the Banco Union and everything, but I can't.
Oh my God, you have
Yes.
lots of things on this week.
Yes. That's my problem.
Job.
Yes, I need to learn to say no. That's my problem.
Yes, I have the same opinion. Yeah.
Yes.
You got the
But,
meaning.
yes.
You catch the trouble now. Let's find a solution.
Trust me. I learned my lesson this time, but
yes.
I don't want. I want about this IMRA. I don't know. No quiero saber más. Yes.
You are running crazy. Just get over of this.
Yes, it's driving me crazy.
Oh, but don't worry. It's
yes.
Just 4 months.
4 months.
Then
4 months.
You are free.
And I forget it about everything.
Yes. Yes. Always when you are the leader or are into that kind of organizations, it happens, right?
Yes. You learned a lot, but I don't. Well, I'm tired about it. You,
Yes, and it's
yes,
stressful.
there is some good points, but there
They are
is bad
not
points.
enough.
Yes, yes. Mhm.
Okay,
Well,
doctor, let me ask you, did you prepare the material I was asking for?
no, sorry.
Okay, well, don't worry, but we need to do it in order to have our homework on this weekend. Because
Yeah, okay.
from the case report you prepare and the physical exam, we can work on this weekend because according to the case, to the clinical case you have, I'm gonna send you lab tests and imaging tests to describe them and practice in this.
Okay.
But I understand you are out of time. You are running crazy.
Yes, but don't worry. Tomorrow it's at 2:30, and I can after that. I think I
Yes.
can afford it. I don't know. Don't worry.
Or, well, I was asking you in that way to, well, I decided to get each student with a personal case for getting in confidence about writing down. It's easier to learn when you are in confidence, when you have that practice, because it's a field where you are well prepared. Well, we have here in the group 1, 2, 3, 4, 5 students that are into the med career and in third year. And I prepared for them a case, an easy case.
Okay.
If you want, I can send it to you, but it's from the respiratory system. Maybe it's not useful for you, not for the purposes you need it. The topic, well, the thing we can do is when you finish, when you have time, you can send me the case.
Okay.
I correct it with the topic points, expressions, well, details that at this moment it's normal to make that kind of mistakes because everybody has mistakes in that. That's normal. At this point, all of us is thinking in Spanish. So
yes,
we have to exchange that Spanish to English ideas, and it's hard to do. That's why all the students were sharing their screens and job, and we were correcting together. That was the idea of this workshop.
Okay.
According to the objectives they are following. We have a gynecologist, and we were talking about gynecology. We have a doctor from the intensive care unit. We have a critical patient. So in that way, I prefer to work in this, well, like in this way, I mean.
Okay.
So do you prefer to prepare it, or do you rather that me send you a dialogue, and then from the dialogue you make the case report and I send you the findings, and then you make your physical exam? It could be an option to do it, a neurological case, but maybe it's not going to the general idea you need.
Okay.
Or
Well,
it's possible for you to prepare it until tomorrow night, maybe.
I think because the time, I think that it's better the second option.
Okay, I will prepare it.
Okay. Yes.
Okay,
Yes.
so give me 1 hour around and I'm going to send it to your WhatsApp, okay?
Thanks. Thanks.
I'm gonna prepare. Do you prefer in pediatrics, of course, right?
Yes. 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 Yes, please.
Yeah, let me look for.
Do you have an example of about the I prepare, I don't know what.
About the case report, let me share one of your classmates. I have some of them that are well done, but well, I have one for trauma. Let me open the chart. Give me a moment. Yes. I don't know where is the file.
Yeah.
For example, Dennis he's from El Salvador, I think.
Okay.
He made a great case report, well organized, grammatically correct with the topics we were talking. It's well done. He only has to correct the physical exam. In this case, he tells to us,
like yesterday, yes?
yes.
Okay.
He's talking in past, of course, because all the information, all the complaints has to be in past because the patient is not at the moment with us. As I was telling you with the guidelines. The general data, 22-year-old woman complained of malaise and occasional dysuria since 2 weeks. Perfect. Since 2 weeks till now. Also, she had noticed leukorrhea in the groin the last 4 days. That's a general idea. I'm going just to the topic, just to the point without rounding ideas, right? Going to the physical exam, he started with the vital signs, like the American way of expression, and that's okay. In England, you just use the temperature and the rest of the vital signs go at the end. That's the only difference we can catch. On exam, he has this mistake. On exam in general, if he tells me NAD, it means that the whole physical exam is normal. But of course, it's not the case. It's not going to be the case. That's why we have to avoid this.
Okay.
And the complaints are not related with the CVS, RS, and CNS, right?
Okay.
So if they are not related to the complaints, you don't need to write them down. Avoid them.
Okay. Only the positive signs.
Yes, just the positive information. He has to tell me here, abdomen, and then goes with the description. And these 2 lines are correct. Suprapelvic tenderness and pain at the right flank during deep abdominal palpation. This on palpation is extra. It's not necessary. You don't have to round ideas or terms.
Okay. Well.
This second line is supporting the complaints. External examination of the genital area doesn't detect any fluid or not. He can say genital area, 2 points, and then nothing to add. And he supports, he evaluated because the patient is complaining of this situation. In other words, just small corrections.
Yes. Okay.
For example, we have another one that is very well mixed.
well.
Yeah, Ivana is talking about this one. It's about a baby. She sent me this paragraph. It has some corrections in this, but she's rounding and rounding and rounding because she's thinking in English. It's not correct. When you talk about a baby, a kid, or not an adult, you have to use this part. Chief complaint, and then explain me what's happening. That's the best way of starting the report. And then you just go to this part. The patient's mom referred that her son started or began with moderate nasal congestion in this case, sneezing 3 days ago. That's all. Without writing the ideas she has at the beginning. She administrated by herself this medication in drops once a day without improving. And then another medication, and then she went to the pediatric and then got the discussion.
Okay.
So she's rounding here. You don't need to round, just go to the point. On exam, if you have data, normal data that it's not related, I repeat, don't write it down. It's not important.
Okay.
Patient alert, active, impaired, general conditions, supine position. So it could be necessarily if it's a neurological situation, but it's a respiratory chart. So you don't need to add this. The
Okay.
parenthesis, cephalic chamber. Well, the babies with oxygen, this part is about treatment. We don't need to add this at the moment. It's not a part of the physical
Sorry,
exam.
but I can see your screen.
You cannot watch it? Oh, let me share
Yes.
it again. I'm sorry. Now, can you watch this?
Yes,
Oh,
yes,
I'm
yes.
sorry. That would be nice if you tell me at the beginning.
Yes,
Well,
no, don't worry.
as I was telling you, don't worry, we can repeat it because there is no one coming after you. We can take the time you need. That's okay for me.
Okay.
When we talk about children, we start with this chief complaint and the principal situation for going to the appointment. That's all. Then our colleague has this rounding ideas, grammar mistakes, because she's still learning social English. That's okay for me if she's mixing ideas, there's no trouble. But the idea of the case report is to make this brief paragraph. You can see the difference, right?
Okay, yes.
So in that way, just organizing the ideas or changing verbs, we can get a correction, a corrected way of talking. In that order, for example, with this baby, the patient's mom referred that her son started or began with moderated nasal congestion, referred or better said, sneezing 3 days ago. She administrated by herself. It's important to say that the mother decided to do this with the medication in drops without improving. Then she starts, well, the baby gets worse and starts this in this schedule without improvement. And then they decided to go to consult to the pediatrician, to the pneumologist. So there are details to reorganize for not rounding and rounding expressions. That's the point.
Okay.
On exam, well, this is a respiratory situation. This is a group. So in that way, she's talking about the neurological status, that it's okay in Spanish. The baby has not a neurological problem at this moment. That's one point. On the other point, she's talking about oxygen at this moment. Oxygen, this is not a mother's choice. In that way, it's not necessarily to add this information at this moment. We don't have to use this. Vital signs are okay. Okay, weight, size, okay, perfect. Blood oxygen, well, we have to correct this expression too. Lots of correct. Local inspection, well, when you go to the physical exam, you don't explain which techniques you are applying. You don't give inspection, everything normal. No, you just go to the points. You say, for example, in this case, what did I do?
CBS.
Yes, CBS, cardiovascular system, of course, rhythm and synchronous. We need no murmurs. Well, everything is normal.
Nothing to add.
Yes, respiratory system is the part we are looking for. Symmetrical and expandable chest. Yeah, from here. Good. Chest with a slight subcostal retractions, lungs with decreased air intake, predical rhonchi, inspiratory striator, even without the use of stethoscope. So this is the important part she had to describe. You see, this is rounding idea, rounding information. We don't need this. We just need this one. Moreover, when we talk about the group, we have to explain if there is cyanosis, for example, if there is the pathological phases of this, we have to give details that she's not describing here. So in that order, I'm going to correct it and send all the corrections to her.
Okay.
And she has to rewrite it again. That was the exercise.
Perfect.
She decided that
Okay.
differential diagnosis, that's okay for me, but it's not necessarily at this moment. We are going to talk about it next week.
Okay.
So, I think you catch the idea, right?
Yes, yes. I can do about the neurological case.
Yes.
I
I
think
think it would be
it's
better
pretty short.
preparing
Yes,
in
yes,
that
please.
way. Don't worry about it. I understand you are without time. Give me a moment. We have here, I don't know if it's here, no está aquí. For example, the way I'm sending the case to the colleagues that are still in career. Okay, I found the file. Is this, and if you prefer, I can prepare it. So there's no problem for me. I sent the general information of the patient, a dialogue with the doctor, and following that dialogue, you write down your case report. You give me your information. And also, I send you the findings, the vital signs, and details for making the physical exam. And if you consider or find more things to add, you can send everything to me.
Okay.
According to your time, there is no trouble for me to prepare something like this, or maybe you would rather to take a case from one of your patients, maybe, or a situation you're ready.
It's one of my patients. I have a patient and I think I can do it.
Yes, I think it would be better.
Yes,
And,
it's better.
Yes, for getting to the objective, to the point you really need.
Exactly. Okay, Iris.
Okay, in that way, as soon as you get the information, send it to my WhatsApp by a picture.
Yes. Tomorrow night.
Perfect.
Please.
And as soon as I receive it, according to your information, I'm gonna send you back some lab tests for making the reports. It's important to catch the idea. And according to that, I'm gonna send you some pictures about CT scan, MRI, I don't know, depending on the situation.
Okay.
With that, according to the diagnosis, you have to send me back the analysis of the imaging.
Perfect.
The details you find. That's the way we have to start learning how to write down in English this part, and it's very important.
Yes.
This is the homework, and well, many students run mad and tell me, what, how I can read it? Well, do it. You got the idea in Spanish, in English is different.
Yes. Okay, Iris, tomorrow night I will going to send you.
Okay. So I think that's all. If there are, I don't think there are questions, right?
No. Yes. At this point, I don't think.
Okay.
Okay.
So take a deep breath.
Yes.
Take a dark coffee to stay alive. Yes, dark and strong coffee.
Yes. I think it's that's the way.
Yeah, that's the way to go ahead. When I was at the med school, I took a drink and dark and hard coffee for studying previously to my internal medicine final test.
Okay.
I got with anxiety, fever, high BP, and I almost was sent to the emergency room because I was very bad, in a bad condition.
Yes, I think.
My professor watched me, and he was watching me, and he told me, you drink too much coffee, right? Yes, teacher, is that okay? Yes, your face is not lying. from that test until finishing the career, I mean, internal medicine in Cuba is in the third year, the whole third year.
Okay.
So while finishing that class, that test until the end, I decided not to drink coffee. And the best option for me was to sleep 20 minutes previously the test. I received the test, the pages, and I was used to sleep into the test 20 minutes. And then when I wake up, I just had the opportunity to finish it faster. All my teachers told me, why do you sleep on the test? You are wasting time. And I said, no, it's better for me, please. Can you wake me up in 20 minutes? What? Please help me. If you want to help me, wake me up in 20 minutes. And it was so fun.
Well,
Yes, my professors understood that was my way of working. So they helped me, always they helped me to wake up. Okay, it's your moment. Okay, thank you, teacher. And being sleepy sometimes, I was answering, but that was my best moment because I got in mind all of the ideas.
Yes. Our brain needs to restore with sleeping.
Yes, it was fun.
Yes, I think. Well, that's
all, I think.
Yes.
So,
So
good luck for tomorrow. Tomorrow is a holiday.
Thanks. Yes.
And I'll expect your job, okay?
Okay. Yes, please, tomorrow night.
Yes, don't worry. So take a deep breath and the secret, drink dark and hard coffee. And then you can sleep like a baby at night.
I'm going to check it down.
Okay. Bye.
Thanks, Iris. Bye.
No, you're welcome. Thank you so much for attendance. Your poll. I'm sorry.
Yes, please.
Yes, I almost forget it.
Please.
No. Okay, I sent it. Can you watch it?
Yes, I can. Ready. Thanks.
Perfect. Thank you for the poll. Thanks for attendance. It's done.
Thanks to you. Bye, Iris.
Bye.
Bye.
See you Monday.
See you.
Okay, I have no details from other students. Nobody told me that it's coming late. And I might consider that everything is done. So